Doctors are also turning tech savvy along with their best clinical judgment. They are looking forward to some kind of technology aid which will help them to screen early, take help of those AI based tools, which will look at the images and then tell whether there is a probability of having that lesion cancerous or non-cancerous. Many solutions say from say Cure AI, which is a Bangalore based company which runs their algorithm and tells whether that nodule is a tubercular nodule or it's a cancerous nodule.
Welcome to today's podcast on MedSynapse, where we bring you insightful conversation with leading experts in medical field. Hi, I'm your host, Dr. Smarika Bhatt, and I'm absolutely thrilled that we have distinguished guest with us, Dr. Anjali Kulkarni. She's a leading expert in the field of oncology. Dr. Anjali is a leader with over 23 years of experience in clinical oncology and healthcare technology. With expertise in oncology, AI, and digital health, Dr. Anjali has a proven track record in product development, strategic planning, and stakeholder engagement, making her a true pioneer in transforming healthcare ecosystem. Welcome, Dr. Kulkarni, for the podcast.
Thank you, Smarika. Thank you so much.
Excited to have you here. Let's jump right in. We'll start with our first question, that is, early cancer detection is critical for improving survival rates, and primary care physicians often serve as the first point of contact for many patients. So, Dr. Kulkarni, what role does primary care physicians play in identifying early warning signs of cancer, and how can they enhance their diagnostic accuracy?
Cancer is a global burden, and day by day, year on year, the cancer cases are increasing globally, more so in our country also. So, currently, we have many new cancer cases diagnosed every year. In our country, most of the time, the cancers get diagnosed at the advanced stage, and there are many reasons to it. One of being the overall the cancer awareness amongst the population, and then second one, there is a delay in getting diagnosed properly and reaching to a proper cancer care facility for the treatment. So in that case, the primary care physician plays a very important role, because most of the time the cancer symptoms are actually not something where they are very uncommon symptoms, or there is nothing very unusual that the patient can really suspect that something is really not going well with them. It can start as simple as evening rising fever, people are losing appetite in some part of some types of cancer. In some cancers there may be frequent stomach pains and getting lot of indigestion problem. Overall, these problems look to be very simple. They are one of those routine kinds when we eat outside, when there is a temperature change, the weather is changing, you are traveling, you might get fever or you might get stomach upset. So, what happens mostly with such symptoms, a patient goes to a primary care physician or the family physician whom they routinely visit. I think they are the first one to give a initial basic symptomatic treatment. Suppose currently there is a viral fever going on in
Correct.
majority of our cities. So when the patient get treated with a viral fever with a basic dose of antibiotic and some kind of medicines to reduce the fever, but for some reason, fever doesn't come down for months together. Patient is really feeling unwell, or he is not able to, cope up with the routine day-to-day activity. Actually, the primary care physician should suspect something, and he can go to an advanced level of basic blood test. So, sometimes viral fever, we don't go to doing any kind of great deal of investigations or the test, but somebody is really not doing well for a very long period of time, I think the basic blood test might give some kind of a clue whether it can be as simple as typhoid, malaria. But if still it is not, after giving adequate treatment for them, I think the primary care physician should either do a more definitive tests, or they can just refer the patient to a higher center for a better investigation. So in that case, according to me, the cancer awareness amongst even the primary care physician is a very, very important part. So they should be able to get those warning signs and they should be able to act upon it and then make sure that patient is quickly passed on to an expert center or a more expert doctor expertise or a specialist to investigate further. And
Okay.
there are many tests coming up which can help even the primary care physician. And as simple as that, many AI tools are coming up from a symptom checker. So if you have this symptom for many times, there is a some chance of somebody having a certain type of a cancer, and then more definitive tests like X-ray or ultrasound can be advised for those patients.
Okay, that's such a valuable perspective you have shared. Now, let's shift some gear towards what do you see the key systematic and logistic barriers to early cancer detection, and how can healthcare professional advocate to changes in these areas?
Yeah, so main limitation can be the proper diagnostic testing facility available. Unfortunately, most of the cancers are not detectable in a very early stage, right?
Oh.
When the cancers are really small, say 1 centimeter or smaller than that, it's very difficult to detect even on X-rays or ultrasound. For that, very high in radiology investigations like CT scan, MRI are required, and every small a hospital or a diagnostic center may not have these facilities with them. And the second most important, even these tests are quite costly. So just on a little suspicion, advising somebody to go off a CT scan worth 7,000, 8,000, or MRI worth 10, 15,000 might not be very justifiable in our country. So in that case, the one is limitation from a availability, accessibility perspective, and the second might be the overall affordability from actually an individual perspective. So we are a nation still where there is lot of out of pocket treatment happens, and even the insurance doesn't cover the OPD charges, right? Even if the good insurance covers don't cover the diagnostic charges for even the cancer, and people tend to spend a lot of money, and in that case that becomes a great barrier for early detection, because the expensive tests are reserved for a very very definitive suspicion or a diagnosis coming towards the cancer. So very initial stage, I think they have to depend on a very basic like X-ray or ultrasound or mammography. In some cases, especially for a gastrointestinal tumor like stomach or a colon tumor, the investigations which are definitive are endoscopy or colonoscopy, which are not very widely available. They will be available in a hospital, and there are limited gastroenterologists overall who can perform that test and diagnose the condition. So in that case, again, the accessibility is one of the challenges or barriers, I will say. And as a cancer, one of the major limitation from a disease perspective is there are hardly any blood tests which will tell you about a cancer, right? People say I'm doing routine blood test, I'm doing cholesterol, thyroid. There are very very few blood tests which will have some indication of few type of a cancer. For example, ovarian cancer have something called a tumor marker. So if the tumor markers are usually in the suppose in less than 30 as a value, and if they are in the range of hundreds or thousands, there is a very strong suspicion of cancer of ovary. Like that, there are hardly, I think it's not more than 4 to 5 blood tests which are work as a tumor marker. And again, that is more of a challenge from a disease perspective, I will say. And that's how it becomes a bigger challenge or a barrier to get the cancers diagnosed in the early stage overall, not only in our country. The second part, which I told about accessibility and affordability, might be more relevant for our patient population, and that's how most of our patients get diagnosed in advanced stages of their disease.
Okay, those challenges are indeed significant. So, building on this, how can physician better integrate routine cancer screening recommendation into annual healthcare checkups for patients with limited healthcare access? Because as you have told, first line of what you call checkups doesn't show the stages of cancer or the early detection of it. So, how we should tell the patient who have limited access can have the annual checkups?
Yeah, so most of the annual checkups nowadays have expanded a bit to have some kind of a cancer screening. So, cancer screening are a type of tests which are performed in the general population to find out by any time chance there are the incidental cancer finding, or there is something called as a precancerous lesion. So, suppose in case of oral cancers, we all know in India there is a very strong practice of chewing the tobacco,
Yeah,
pan,
correct.
gutka, jarda, khaini, and many forms of tobacco. And we are one of the countries who have very highest form of oral cancers. And this is the one thing I think primary care physician, even for that matter, the paraclinical staff like nurses, if they are trained well enough, they can identify very early lesions or something called as a precancerous or a pre-malignant lesions in the oral cavity. And for that, I think they have to be equipped with the proper training to identify that particular patch, which is white color or a red color, or there is something called as a submucous fibrosis, which very easily can be visualized. So the first is the training of this paraclinical or the nursing staff, and even the junior staff when they go for community screening or they are sitting in any outpatient. So these are the tools which can be capable. Nowadays, there are many apps have come with which a simple mobile photo. They are through the AI algorithm. They are able to detect whether it is highly suspicious of cancer or not. The second most very accessible. So in that sense, the oral cavity tumors are very easily identifiable by a trained person if they happen to come across any such patient. The second most common is a breast cancer. So any lady going to a gynecologist for her routine checkup, or even with a suspicious of a breast lump or a breast abnormality or abnormal nipple discharge, the gynecologist can do a very simple breast examination by her own hands. Not even any machine is required, and in that case, it can be very early detected if the some lumps are some abnormal lump are found in the breast, and
Okay.
that can be even trained to a nursing staff or even a basic family physician or a primary physician can identify the breast lump if they are palpable and the woman is symptomatic, right? So the breast self examination, we tell women to do it themselves every month, but if by chance they go to any doctor, I think every female visit who visits a doctor can do a basic question answer. Do you find anything abnormal? If not, they can go ahead and do a breast self examination. Again, that is very early detection is possible in the breast cancer. The second, third most common accessible is a gynecological cancers in a women, especially cervical cancer. We all are hearing about cervical vaccines, HPV vaccines, which are being promoted now in the pubertal and adolescent girls and young females. So similar way, if somebody visits gynecologist with a particular symptom of a bleeding or a discharge, gynecologist can do a simple gynecological examination of a woman, and she will be able to find out if there is anything normal. There are very simple tests like a pap test are available, or a lugol iodine test, or many tests are there which can be done as an outpatient and a very cost effective manner to find out if there is anything abnormal possible in that women or not. The second
So,
one can be doing a simple chest x-ray. If somebody is chronically telling I'm getting blood in the cough, or there is a weight loss and somebody is constantly feeling there is some chest congestion or difficulty, I think the chest x-ray also will be able to help if there are any tumors in the lung. And the third commonest, which all of us at a primary level can do is a ultrasound. So ultrasound is also a quick modality. If there is any abnormal lesions or the lumps in the abdominal cavity, ultrasound will be able to find if they are sufficiently big. If it's a very small lesion, I think ultrasound may miss it, and then we have to go to higher tests like CT or MRI.
Correct, correct. Absolutely agree. Those were excellent points you have shared. So, speaking of patient engagement, what strategies can physician employ to increase screening adherence in patients which have limited health literacy or face financial challenges, mostly in the remote areas?
I think the basic what we all can do, I think at even our country level or a population level, is overall health awareness. We have seen, HIV campaigns, or we have seen the most successful polio campaign, or the very recent example of a COVID vaccine. I'm sure everybody in the country knows about COVID now, and they are, because the awareness through different media channels, the TV channel, the social media, and doctors were coming out, they were making videos about COVID, and so many things happened. So I think the similar way, the overall health education or the awareness about the disease is important part. It can be done, of course, by a government at a larger level. It can, a lot of NGOs are working on it. Even the hospitals are trying to do. But I think even individual clinician level, they can have that, a small awareness or education session for the patient coming to them for any other illness, right? And in that case, even for a remote people, there can be a routine camps arranged just to give them a basic awareness tips about try to avoid eating tobacco, don't smoke. Again, consuming alcohol have is a high risk for many type of cancer. Maintain oral hygiene. Women should have a good gynecological or a menstrual hygiene, and anything which goes really wrong, they have to consult a doctor immediately. So this basic awareness, I think, has to be built upon, and for that, the physician should build the confidence in the patient or the people they come across, or along with the physician, other paraclinical staff, and the staff who comes in touch with the patient all the time. It can be a doctor, it can be his assistant, a nurse, a lab technician. I think everybody can play a bigger role in these small educational tips. And I think just a mere developing awareness and sensitivity towards this topic will go a long way. And of course, the mobile phones are doing a lot of good things, and in that, one of them can be just awareness. So, some celebrity uploading some video, I'm sure there are many people who sees it, and that is one more way. I think a lot of celebrities are coming forward with their cancer diagnosis, and that even helping people to come out with their own. Otherwise, there was a lot of hesitation in sharing the information if somebody gets diagnosed in the family. I think the things are changing, and that's again one way of learning. So somebody in my family, neighborhood, in my office gets it, so other people tend to know why it happened and what the way go through. I think the word of mouth and the positive messaging, like go to doctor early, early detection is a key, should go across all the.
So the campaign part you have touched that doing it via celebrity is very practical and impactful. That I'm sure will actually work in the future and we'll see great
Right.
results. So lastly, we'll wrap up the podcast with one last question. In the field of early detection, cancer early detection is evolving so rapidly. So what are some of the emerging diagnostic tools like liquid biopsies or AI-driven imaging that physicians should be aware of for early cancer detection stage?
Yeah. So, very few cancer can be detected very, very early. And in that case, I think some of the few tools have proven to be very effective, especially with the AI, artificial intelligence, machine learning, help, some kind of, we will say, on edge, or the kind of lesion which will take some time to clinically become problematic, so that patient at least should wake up and go to the doctor. So few of the tools are like image based tools, and there are image like mammography images or x-ray images, where the primary care physician, or for that matter even the expert physician, take help of those AI based tools, which will look at the images and then tell whether there is a probability of having that lesion cancerous or non-cancerous. I think there are many solutions are being built. Even few of them have got regulatory approval. So many solutions, say from say Cure AI, which is a Bangalore based company, which runs their algorithm and tells whether that nodule is a tubercular nodule or it's a cancerous nodule, things like that. And there are a few thermal based imaging are coming up for the breast imaging. So what happens, mammogram, you have to have a proper X-ray facility, and then you have to have a protection, the lead protection around, so that X-rays, other people are not exposed to X-rays and things like that. So this thermal based imaging are very safer. They can be done. I heard that even they want to keep this thermal imaging in the malls and things like that. So where it's not much protection is needed, and they can be simple measures which will be able to tell us whether that lump is suspicious, or even before forming the lump, are there any sub centimeter, what we call it as a microscopic level, is there any activity around, and it can alert the physician to keep a lady on a regular follow-up, right? Similar way, there are many AI solution. I was telling you are mobile or smartphone based, where you take a picture of oral lesion, and that will tell you whether it is falling into some precancerous or a pre-malignant, or it is completely normal. In that case, again, that patient can be told not to consume tobacco. He can be advised better hygiene. If it is really suspicious, we can just take a scraping and make sure that whether it's a cancerous, non-cancerous, or likelihood of becoming cancerous very soon. So few of these, I think, tests are coming up in a very definitive way, which will be helping physician for early detection, or can empower them to take a better decision. So in the oral cavity, in the breast cancer, in the X-ray for chest nodule, and even people are doing for a colonoscopy. So any occult blood in our stools might be there is a chance of colon cancer, and there are a small home-based kits are available where you can do the test yourself at home and make sure that result is normal or abnormal. Accordingly, you can visit the doctor. Similarly, for a cervical cancer in women, there are self-testing kits are available where we can test the HPV DNA, and then that will tell us whether there is any abnormal cells or not. So there are many tools coming up. I think doctors are also turning tech savvy. They, along with their best clinical judgment, they are looking forward to some kind of technology aid which will help them to screen early, which will help them to cover a wider population. And I think that's the way to go in cancer screening.
It's fascinating to see how technology is transforming healthcare in recent times. Thank you so much, Dr. Kulkarni, for sharing your insights with us and joining us today. And thank you to our viewers for tuning in. And remember, if you are a healthcare professional who is eager to delve deeper into medical topics or have questions, do not hesitate to join us on MedSynapse platform. MedSynapse platform is not just a resource, it's a dynamic space where you can connect with your medical peers, participate in meaningful discussions, and contribute to the ongoing evolution of healthcare. So until next time, stay healthy, take care, bye-bye.